Bismillah ar-Rahman ar-Rahim. I would take this opportunity to thank Dental Health, especially Salman Maniyar, the organizers, for inviting me for this Dentech session. Thank you, Dr. Amreen, for coming. And I don't see much of a gathering here, but can I interact with the students? How many students do we have over here? I'm a student too. Okay, right. And how many residents from Orthodontics? Anybody? Okay. So when I was given this topic of the interaction of the implants with orthodontics, the first thing that comes into mind when we have an interaction with a maxillofacial surgery in orthodontics is orthokinetic surgery. Okay. Since maxillofacial surgery is ancient and orthodontics is relatively new, the newer part is implants, right? And I was of the opinion that हम जब इसकी बात करेंगे, then we are actually talking about TADs. You all know what are TADs, temporary anchorage devices, right? But the things have moved forward. Dr. Amreen would be knowing it, that now with the advent of more modern ways of using implants, this interaction has gone a long way, and I'll be highlighting few areas where the orthodontics and the implant dentistry would come as an interplay. So orthodontics and implants can be combined effectively for various treatment needs. This combination would simplify the treatment, improve the outcomes, and expand the treatment possibilities. We'll see in next 20 minutes how it can work. So the interaction between the orthodontics and the dental implants can be of two different types or at two different levels. One is orthodontic in preparation for implant placement, and the other is orthodontic interactions after implant placement. So my topic would be divided into those two areas. So first is orthodontic in preparation of the implant. Right. So when we are preparing the site for receiving the dental implants, orthodontics is worthy. So orthodontic tooth movement can prepare the site of implant placement. Orthodontic extraction and augmentation of the tissue is better with implant if you have an augmented natural bone, right? And accurate positioning of the teeth will facilitate the accurate position of the implant. So embarking on this, we know with our knowledge of orthodontics that when we move teeth orthodontically, what we are doing is we are taking the support structure along with it. So there is an area of tension and the area of compression. The tension area is where the bone is going to form, and the compression area where you have the osteoclastic activity going on. And this movement actually takes the whole apparatus together. So your bone, the soft tissue, and the whole apparatus moves along with it. Stay with me and I'll show how. So the orthodontic tooth movement significantly impacts surrounding tissue like bone, gingiva, and soft tissue. Number two, while this bone remodels, the periodontal ligament, gingiva, and soft tissue also respond to this movement. And this is a norm for orthodontic movement, provided you are doing it gently, okay? And causing the frontal, not the undermining resorption. So orthodontic extrusion does not harm the periodontal attachment apparatus even in the presence of pathology. We need to keep this in mind. If you have a periodontal issue, if you move them and extrude them, this is not going to harm the teeth. And the orthodontic extrusion of teeth with advanced periodontal disease can still be positive in clinical and histological results. So see if you have a tooth which is labeled for extraction. See, you cannot actually save this tooth, right? So what you do is you actually do a core build-up and extrude the tooth out of its normal socket. What you're doing is you are extruding the tooth. So what you're doing is you are actually taking the whole apparatus along with it. So what you are doing is you are generating, yeah, this is not working properly, please. So what you're doing is, you are generating the patient's own bone, which is an autogenous bone. यहाँ कोई graft नहीं किया आपने. So what you have done is, a tooth which was liable for extraction, you have extruded the same root out of the socket, thereby bringing the bone along with it. Now you have an autogenous bone created by the patient, ठीक है, for receiving the implant. So this is one way in which you can use both orthodontics and implants together. So orthodontic is helping the placement of the implant. Second is, I know we have prosthodontics over here, we have general practitioners over here. हम सब bridge बनाते हैं, ठीक है? For making a prosthesis or a bridge, you do not need the alignment of the roots, ठीक है? For implant, you need absolute alignment of the roots so that you can place the implant right bang in the center so that your prosthetics comes on top of it and it works. So orthodontics can help in this area as well to receive the implant. You can upright the teeth which are not correctly positioned, and so that you can create an environment for the implants to go in. Let me show you a video. So we know that there is mesial migration of the teeth when you have an extraction socket. So 6 extract kar diya, 7 mesially migrate kar liya, you want to place the implant on the 6. Orthodontic will come to help. And you can use many different ways, Dr. Amreen will tell you, but this is one of the simpler ways, right? Just upright so that you have an exact space for the implants to go in, right? Interaction between the implants and the orthodontics. Next, you have the most commonly missing teeth after your third molars are lateral incisors. So you have a missing lateral incisor. What you can do is, you can create a space for the implants to go in for lateral incisors. See? Now highlighting the fact, when you do this, can you see there is a little bit of a bone loss over here, which was not there when you actually extrude the tooth out. Had there been a root there, I would love to take the root out so that you can have the exact bone, and you do not get this bone loss. But if you do not have the tooth there, you have a missing lateral incisor, again the orthodontics would help. Another way, where you have actually the extrusion of the molars because of the missing opposing molar, you can use TADs, temporary anchorage devices, place them on the buccal and on the palatal aspect, and then try to intrude the molar so that you can have a space for the prosthesis to come in for the lower arch. See, a simple method of using a power chain and causing the intrusion of the molars so that you have enough space for the implants and then later the prosthesis to go in. So this is where the orthodontics is done before the implant placement. Now there is another area where you can do the orthodontics after the implant placement, or use the implants for facilitation of orthodontics. How? So you can have it for anchorage. You can use it as a direct anchorage device where the forces that originate from the implant itself, यानी आप खींचने के लिए implant को ही use कर रहे हैं. Implant is used as an anchor unit, right? Or they may be of two types, direct or indirect. Now, one is implant-driven anchorage. Consider a scenario where you have missing posteriors, यानी molars missing है, ठीक है? And you have the anterior segment which is also crowded, ठीक है? To align this, it would be difficult to do, right? So what you can do is, oops, what happened? Okay, right. So what you can do is, you can place an implant at the level of 6, get your orthodontics, and aligned on the basis of that integrated implant, which has higher stability, okay, would consume less time and give you a better result in terms of getting the anchorage, right? Or you can use mini screws, which are temporary anchorage devices. You can place in the buccal mucosa and on the bone, and you can pull the segment together. Advantage, it gives you increased stability, it gives you reduced treatment time, and gives you a better predictable result. Another is an indirect anchorage, where the implants, usually the tags, the temporary anchorage devices, are used along with the braces. वो भी लगे हुए, साथ में आपने tags भी लग दिया, and you are encouraging, you are increasing the anchorage as seen in there. So in this, the indirect anchorage uses the implant to stabilize the dental unit, which serve as anchor. इसका जो most common है is the palatal implant. ठीक है? For anchorage of the molars, you use a palatal implant. पहले हमारे पास transpalatal bars होते थे. ठीक है? Now you can just place one implant in the center, and this will give you absolute anchorage without mesial movement of the molars. And this will give you high anchorage levels with low movement in the proximal segment. Another example is where you can use it in the retromolar area as well. Then mini screws can be incorporated or within the arch wire. देखें इसके अंदर arch wire के अंदर you have a hook solder there, and the arch wire is being pulled along with the total dental segment with the anchorage device or the implants. So you can use tags for mesialization of the distal segment. Along with the wires, which gives you the guide. The wires and the brackets in this case will guide the position of the teeth. Or you can use it for intrusions. Simple deep bite case where you have deep bite in the lower arch. What you can do is you can use the brackets along with one implant, right? And you can cause the intrusion of the whole arch in the anterior segment. So thereby you are eliminating the curve of SP. And get a perfect occlusion. Similarly, in the upper arch, if you have the extrusion of the upper incisors and causing this exaggerated curve, you can intrude the upper incisor using a similar procedure. So, orthodontic interaction after implant placement would focus on implants offer absolute anchorage, which is more predictable and efficient than the traditional anchorage. Implants can be used as anchor in a direct or an indirect fashion. Direct anchorage uses the force that originates from the implant itself, while the indirect is along with the braces that is there. Another use is with the aligners. I believe the next lecture is on aligners, so Dr. Abbas would be explaining more of aligners with you. But aligners have their limited focus, and to create more versatility in the aligners, you can use tags or temporary anchorage devices or implants to actually create certain movements which are not possible otherwise with aligners. So again, can be used along with aligners. So we talked about tags. They're very good, but they have their issues. If not placed correctly in the right place, it may cause complication. It may cause injury to the root of the teeth, which is the commonest of all. It may cause the loss of vitality of the tooth. It may cause transitory loss of the pulse sensitivity. It can cause chronic inflammation of the gingiva and the soft tissue around it. It may also cause lesions of the buccal mucosa in terms of lichen planus or something, soft tissue necrosis, and perforation of the floor of the nasal cavity. Even adverse effects were also reported after the mini screw removal and included secondary bleeding, microfractures of the implant, and then exostosis. So in conclusion, the combination of orthodontics and implant can provide significant benefits for the patient. Orthodontics should be knowledgeable about the implant modalities and their applications. The future of orthodontics is likely to involve more integration of dental implants and aligner therapy. Thank you very much.